Well, hello everybody, this is the planet Earth here. Alright, so I'm going to talk about mental illness. Okay, so you see my laptop here. Alright, phone jacked up. Anyways, I'm getting a little laptop in a couple of days, so I'm not worried about it. I'm not stressing. Actually, I am. Alright, so here's the deal. This is mental illness. I'm going to explain everything. So if you want to learn about it, and you want to know what your family member or you're going through, then watch this video, because I've seen it all. Literally, I have seen every aspect of mental illness, includes the worst to the best. Alright, so let's get this party started here, and I'm going to tell you about mental illness. This video could be 20 to 25 minutes long or longer, depending on what I'm going to tell you. Alright, so you see my fat ass here, right? I have to exercise at one of the fancy gyms over here. Oh, you Californians and your spoiledness, I'm telling you. The only thing you guys worry about is earthquakes, and that's pretty much it. Alright, so here's what's going on. Mental illness. Let's start with schizophrenia. Schizophrenia has got to be one of the scariest mental diseases in the world. The scariest. Other than panic attacks. It is just disturbing, debilitating, scary. And without antipsychotics, I am sorry, there is no natural cure for it. And if there is, I'm hoping they find it. For bipolar, especially bipolar, because my aunt's bipolar, and that's another reason why I'm in California, depression and anxiety and multiple personality disorders and psychosis. All of the major ones. And here's the reason why. God dang boat, would you stop moving? Stop moving. Stop moving. Anyways. With schizophrenia, bipolar, anxiety disorders, and personality disorders and or phobias could all contribute to mental illness. If you suffer from schizophrenia, bipolar, depression, or anxiety, I'm sorry guys, but you're stuck with it. I'm stuck with it because my mom and dad, all they did was drugs when I was a kid, before I came out of vagina. And my ex-girlfriend made a video about me. I'm a sex craze freak. Technically, I'm just wanting a girlfriend. You know, I just want. I'm at my prime, I guess you could say, for wanting to procreate. It's nothing bad. It's just I'm not gonna ever force anybody to do it. I just want, you know, to have some fun time. What's the big deal? Fun time. God, I'm human. I can't have fun time, I guess. Whatever. Mental illness is very, very debilitating. My mental illness, and I'm gonna be straight with you, and I'm gonna tell you everything that I've had, because I told you guys I won't lie anymore. My mental illness is a moderate form of physical anxiety and mental anxiety. My other form is some sort of psychosis and depression. The psychosis comes out when I'm around my aunt. And when I am around negative people, I'm negative myself, but when I'm around other negative people, it brings out a form of some kind of depression or sadness. Now, it's a rare form. I seem to be able to cope with whatever mental illness I have naturally without medication. Most medications I take give me some kind of weird side effects that doesn't happen in other people. I get weird ass side effects, so I don't take pharmaceuticals, except for Ativan. Ativan is lorazepam, generic, also known as the addictive drug. It's a very potent short-term benzodiazepine. I have learned so much stuff in mental and ER rooms. I've seen it all. I've seen weird things. Oh my God, I have seen the most weird things you could think of. If you are bipolar, schizophrenic, anxiety, depression, or stalking people, aka Fuzzy Boyle, you gotta learn to stop stalking people. Now, if you want to find me, I'm in Marina Del Rey, and if you want to, whatever, find me. Jesus Christ, it's not that hard. I'm not gonna give my exact address out, but at the same time, I don't care. You know, if you want to meet up and say, hey, how you doing? Are you the planet Earth? You know, if you're gonna shoot me, shoot me. Jesus, get it over with. Stop stalking. I got a lot of stalkers on YouTube. I had to block a couple of them. I mean, they were literally stalking me, asking me personal questions and shit. So I had to block them. But You know, if they want to come and find me, it's not that hard. Take an airplane out here. Good luck trying to get to me, though, because, you know, we do have guns on board. Anyways. And everybody else on the dock has guns. So if I were you, I'd be careful trying to jump over the fence. Anyways. They also have security cameras here. HD security cameras, 1080p. Recording consistently on all docks. There, that should make you a little bit more happy to break the cameras that you can't even see. Anyways, that's not the point. The point of the video is stalking, anxiety, depression, schizophrenia, and bipolar. Bipolar people just really piss me off. Because they won't shut the fuck up. Although they have no control over it, that's how I feel. I have a mild form of bipolar, so I try to limit my talking as much as I can. That's called hypomania. Now, my form of bipolar is controllable naturally. It just depends on the situation. I do not get manic when driving. I do not get manic on most days. I won't be manic. I'll be happy, but not manic. There's occasions where medication like Paxil have triggered a very manic phase of hypomania to where I think it was full bipolar. However, if someone tells me to shut the fuck up, or shut up, or stop talking, I will stop talking. People with major bipolar disorder, as 2 or 1, mostly 1, will not shut the fuck up. Schizophrenia is a very serious disorder that you can't tell someone to shut up with. You can't tell someone to stop talking. Their disorder is so severe, it's very debilitating without medication. And I'm sorry, even if the pharmaceutical companies are evil, you have to take the antipsychotic. I'm sorry. I have to agree with the pharmaceuticals on this one. Luckily I didn't develop schizophrenia. I think I would go crazy if I had it. And I'm on edgy about that. There were certain times when I took certain medications in a psychiatric unit when I was hearing trains. And there was no trains there. I'm like, guys, do you guys have is there a train station nearby the hospital or something? They're like, no. Why? Well, I hear trains all the time. When I was in the shower, guys, I was literally hearing fucking trains. This was back in 2010. That's when I started having fatigue all the time. I think it was a permanent side effect from one of the medications. I had EPS syndrome, and it feels like you can't feel your muscles. It's literally, you cannot feel anything. You can move everything, but you can't feel what you're moving. So it kind of feels like your out-of-body experience. For 5 days straight, I was hallucinating off these drugs, these pharmaceuticals. I had to tell them to tie me down because I felt like I was going to try to jump out the window. But as soon as the medicine wore off, I was back to normal. But I literally wanted to jump out the window. I was like, please open the window and let me jump out. The pharmaceuticals fucked me up to that point. I was like, please let me jump out. Please let me jump out. I can't take it. I was seeing stuff. I wasn't seeing shadows. I wasn't seeing demons or angels. I was seeing the walls. This is all they were doing was like this. They were moving like that. It was so weird. I thought I was turning schizophrenic that day. I asked the guys, do you guys have any Benadryl? They gave me a shot of 50 milligrams of Benadryl to counteract the severe side effects of the medication that I was experiencing. I wasn't experiencing physical side effects, it was mental side effects that Benadryl can actually help fight. Because it's a reaction. You're having a mental reaction to the medication. It still has a physical effect, and it will stop the hallucinations. Thank God it stopped within an hour, and I was scared. I was literally, oh no, I'm going to turn schizophrenic. I started crying. I was literally like, oh my God, I'm turning schizophrenic. I started crying, and thank God they had Benadryl there and shot me with it. And then I asked for some Ativan. I said, nurse, please call the doctor and give me some freaking Ativan now. I'm having a panic attack. I'm seeing shit that's not there. It's not normal. Even though I was very conscious. I was very alert. I was scary. I cannot imagine going through that 24/7. It's a terrible, terrible disease. And that's not schizophrenia. That was just hallucinations from a severe side effect of medication called trazodone. The triangle pills. Another side effect of a medication I took was I took the medication and I didn't wake up for 3 days straight. I think it was a mild mini coma, or not a mini coma, but I just couldn't wake up. I couldn't stay up. They tried waking me up. They were shaking me. I could feel them shaking me. I was like, my tongue was out. I couldn't move my tongue. I was just like, Jesus, this is hell. So I just went to fall back asleep. Then they gave me an anti-side effect drug to go with the medication. They tried me on phenazine. They thought I was just batshit crazy. I'm not batshit crazy. The thing is, I have anxiety. Anxiety causes me to get psychotic. When I have anxiety, I get very psychotic. Not actual, but psychotic, I guess you could say. I have only had one girlfriend, and that was Kayleen. Her name was Kayleen. I had nobody else. Never. I lied to her. I shouldn't have lied to her, though. But I told myself I wouldn't lie anymore. Being inside the mental institution sucked a big fat donkey dick. I got my first kiss in the mental hospital, but I never had fun time in the mental hospital. We almost did, though. It got to that point, but never a relationship. Another thing with mental disease, anxiety attacks. Anxiety attacks are the most severe, debilitating piece of shit in the universe for humans. My pulse jumped up to 180 to 190 beats per minute in certain situations, in certain stress factors, at certain times. When my thyroid was fucked up thanks to the fluoride in the water, I had a very high thyroid level. And I don't know what the medication that was causing it, but it was high as hell. My heart rate jumped up to 200 beats per minute. Not suddenly, but gradually. I thought it was a panic attack, so I called my EMS services. They were checking. They said, you're having a very fast heart rate, but it's normal. They said that's not normal, so they took me to the ER room. They shot me with 50 milligrams of atenolol, shot the heart rate down back to about 100. That wasn't slowing it down, so they shot me with Ativan. That slowed it down back to 60. They didn't give me any other drugs. They were trying to give me a very strong antiarrhythmic drug. I said, oh, hell no, you ain't giving me that. I declined it because I've seen the side effects, and some of them are bad. And I told them, just give me Ativan. Try Ativan on me. Try Ativan to get the heart rate down. Maybe I'm having a panic attack, but it didn't really feel like a panic attack. As soon as they shot me with the Ativan, and I hadn't had Ativan in months, they gave me a 2 milligram shot of Ativan and 50 milligrams of atenolol, and shot the heart rate down to 60, and after the atenolol wore off, it stayed at 60 beats per minute, 62, 64, 66, 68. I used to have that pulse ox. I became so paranoid of looking at my pulse every 5 seconds. I think I caused more panic attacks by doing that. So if you have a pulse ox, use it for emergencies only, or when you feel short of breath. Another thing is, my shortness of breath is actually caused by a massive, and I mean massive, acid reflux problem. My actual shortness of breath was caused by Klonopin. It was not acid reflux. It was a side effect of the Klonopin, was acid reflux and shortness of breath. It's called respiratory depression. I was able to breathe fine. Now this is going to kill me, but I took 4 milligrams of Klonopin, and that's what sent me into ER. I was, I can't die from it. I cannot, because technically you're getting your oxygen, but it feels, your nerves say you're not getting enough oxygen. So even though I was getting perfect oxygen, even though my muscles went, I could move, my lungs just fine, I was getting 100% oxygen, but there was some kind of depression feeling of shortness of breath that was physical. Even though it won't kill me, it is scary as hell, so I can't take Klonopin. I can take it, but very small doses. If I take more than 5 milligrams, 2 milligrams, I start getting the side effects. Klonopin is very strong, but it does not work for me. Xanax doesn't work for me. Ativan does, and diazepam is like taking sugar candy. Pop 5 milligrams, 20 minutes later, nothing. Pop 5 milligrams, nothing. 30 milligrams, nothing. 40 milligrams, nothing. 50 milligrams, nothing. 60 milligrams, okay. But the absolute, in general, the worst two mental illnesses is schizophrenia and anxiety attacks. And anxiety disorder. Nothing is scarier than these two right here. Now, a psychotic person could repeat themselves 2,000 or 3,000 times in a row. I saw it in the UCLA place here in Los Angeles. Bad shit crazy. Bad shit. Just pure psychotic. These guys came in, banging their head against the wall, tackling the nurses, fucking smashing their head against the wall, bleeding from the brain, fudging, cutting themselves, or even they could get forks, and they were just jabbing themselves in the head. Of course, they're plastic forks, so they make them bleed a little bit. Oh my God, it was like hell. They repeating themselves, screaming. That's pure psychotic. Trying to hurt the nurses, trying to hurt me. I've had it all in my experience, 22 years of experience of mental hospitals. And the reason I go to mental hospitals is because sometimes I run out of medication, which is out of that, and I end up having the worst panic attacks ever. I call 911, they check my advice, say, why do you keep calling us? You're wasting our time. I'm like, to you, I'm wasting your time. To me, it feels like a medical emergency. One time, it was a medical emergency. My pulse was 225 beats per minute. My blood pressure was 200 over 110. And my skin was white as hell. Like white. There was no red in it. And what it was a reaction to a new drug that was given to me. Of course, more side effects. Yes, that was a medical emergency. They started an IV on me. I was like, guys, I'm going to die. My heart's probably going to give out, or I'm going to die, so give everything to Kenny in Ohio, my friend. And I thought I was dead, and that was it. I thought I was actually going to pass away today. It didn't shock me. What happened was, they gave me a medication that severely stops the heart rate fast. Doesn't stop it, or I'll be dead. Stops the heart rate. It skips, and you can feel real shitty for about 5 or 10 seconds. I think it was called an ablation. No. It's some kind of medical procedure where they inject you with a chemical, and it stops the heart from going too fast. And it stops the heart. I felt it stop. It would not beat, and then boom, 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 and then it went back to normal, and I was fine after that. Never happened again. So to Abilify and Seroquel taken at the same time, fuck you. And to all those other stupid ass drugs that caused me to have bad reactions. It was a high dose of Abilify. That was my first dose. I think it was like 15 to 20 milligrams. I never took it that much before, and I had a bad reaction, and the combination of a bad reaction to Depakote and a combination of a bad reaction to Seroquel at the same time skyrocketed my heart rate. It happens to a lot of people. Oh, my heart was going so fast I could barely feel the pulse. That was genuinely scary. So I dialed 911. I told them, I opened the door, and my pulse goes. It was like. I mean, it was going fast. The max they clocked it out was a 230. So, that was scary. Yes, I could barely feel my pulse. It didn't hurt. But motherfucker was speeding like a mother trucker. Jesus Christ. Ugh. And when they did that, a chemical injection to stop the heart and restart it, I don't know what it's called. I think it was some kind of, you know, like when your heart goes out of control suddenly, but you're not actually dying, but it goes out of control, and then they have to. It's like that without the actual pads. I told them, they said, do you want to do the pads or do you want to do the injection? We have to do it quickly though. I said, do the injection. All of a sudden, you wanted to throw up, and you're like, I'm like this in the bed. I feel very weird. Like that. And then I finally came back. Anyways, I don't know what the medicine was called, but it was a chemical intervention. And it worked fine. I will never go through that shit again. That shit felt nasty. It felt like somebody took a truck and set it on your chest for about 5 seconds. Kind of like a heart attack, I guess you could say. But other than that, I'm done here. The worst mental illness that you could suffer with is going to be, and I'm going to say this straight up, the two of them, schizophrenia and anxiety disorder. And guess what? I have the anxiety disorder. So with my anxiety disorder, I suffer every day, terrorizing panic at times. Other days, I am perfectly normal, and I can go and go to the beach, ride the bus, take a vehicle, whatever I want. Sometimes I like riding the bus because I'm not familiar with the areas, and I don't want to get the car jacked up because it's all clean now. And sometimes I just take the vehicle. Sometimes I'll ride the bike. Sorry guys, I'm high and Ativan right now and Benadryl at the same time because I had a sneeze attack earlier. I was sneezing at least 50, 60 times in a row, and it literally started hurting. So I took some Benadryl and I took some Ativan. If you're going to be addicted to a sleep aid, get addicted to Benadryl because you can't really get addicted to it. But it makes you tired as hell. Alright guys, thank you guys for watching. This has been the THEPLANETEARTH here. I hope this video has been helpful for you. And if you see that I'm fat, it's because I am. I weigh 195. And if I sound like a little gay faggot, that's what everybody keeps calling me, is that gay faggot. They call me gay. I'm not even close to it. And if people keep calling me a sex crazy maniac, it's only because I'm lonely. And just want, some attention.